People who have got long-standing diabetes tend to develop narrowing of the arteries which are supplying the leg. Arteries means blood vessels which are supplying the legs. So whenever these arteries get narrowed down because of cholesterol accumulation within the vessel wall, that leads to reduction in blood supply to the legs. So this is what we call as the peripheral arterial disease. Peripheral means in the limbs, arterial means blood vessels which are supplying, and disease as we all know. So whenever there is a narrowing of the blood vessels supplying the lower limbs, that is what we call as the peripheral arterial disease. In the early phases of peripheral arterial disease, the person might not experience any symptoms, and with progression of the disease, there could be a claudication or leg pains. Whereas in people with diabetes, these pains might not be so much manifest. So later on, when there is a extensive reduction in blood supply to the lower limbs and causing pain even at rest, or even blackish discoloration of the toes, that is what we call as the gangrene, then we should suspect it to be a critical ischemia. Critical means beyond this, any further reduction will lead to a loss of the limb, or there is already an existent loss of the limb. Loss of the limb means a gangrenous or a blackish discoloration of the foot. We will not be able to bring it back to the normal color or restore that function of that black discolored toe or the foot. So diabetic foot, in conclusion, is a disease where there is a reduction in blood supply to the lower limbs, which can lead to leg pains on walking initially, but with progression of the disease, there could be blackish discoloration or gangrenous changes in the limb. So it has got a wide range of presentations due to reduced blood supply to the lower limbs. As we all know, diabetic foot is mostly related to diabetes. But we need to understand that beyond diabetes, certain other conditions can lead to an aggressive or an accelerated progression of the diabetic peripheral arterial disease. Notable amongst them include smoking, obesity, chronic kidney disease, and advanced age. These are the 4 common diseases beyond, and high blood pressure. So these are the 5 common conditions beyond diabetes which can lead to aggressive reduction in blood supply to the heart. So most important of them being smoking and elderly age and chronic kidney disease. That means a reduction in the kidney function also leads to rapid progression of the lower limb blood supply. People with diabetic foot can present with leg pain, but that's an advanced phase of the disease. In the early stages, what we see is if they can observe their legs more closely, they can see that the leg on the side where there is a disease becomes thinner, and it loses hair on the leg. Leg means from the knee to the ankle. In that region, if the lower limb loses the hair, so loss of hair, thinning of the leg, and sometimes reduction in sensation on that side of the limb, or sometimes excessive tingling and numbness of the leg on that particular side. All of them are features of early stages of diabetic peripheral arterial disease. At this point of time, patient might not experience any leg pain. Subsequently, over time, these people, especially who have got diabetes, might not experience the classical leg cramps which people observe when there is a reduction in the blood supply. So those are the people, diabetic patients, usually they do not have the classical claudication or the leg cramps when the patient walks. So many a time it is a painless progression of the disease in diabetes. Early phases, thinning of the limb, loss of hair, shininess of the skin, and sometimes tingling and numbness of the feet are the early phases. No leg pain. Then the disease goes aggressively and affects the tips of the toes. They can become blackish discolored. But before that, what happens is, diabetes is a disease which not just affects the blood vessels, it affects the nerves, it affects the joints. So the nerves, when they get affected and the person walks without any proper footwear, that means without chappal and home or somewhere, what happens is they can have a trivial trauma, and when there is a trivial trauma that is usually unnoticed, that leads to a small ulcer on the foot or on the toe. Majority of the time the ulcer is painless because diabetes affects the nerves. We already knew that. So when there is a nervous affection, there is no pain. So the ulcer, they might not have the sensation of an injury to the foot also because they did not experience pain. So the neuropathy or the nerve damage due to diabetes leads to injury of the foot. This injury will not get healed because there is already a reduction in the blood supply to the foot. So that is where the neuropathy and blood vasculopathy, that means blood supply problem, together lead to a non-healing of the wound. In addition, there is a musculoskeletal deformity. Whenever we closely observe a diabetic person's foot, they have what we call as the claw foot or a bent toes. So whenever there is a claw foot, the patient has got bent toes, they will be prone to further damage because the limb is little distorted. They might be externally rotated, they rotated to the other side, that can cause more friction and damage, and then they increase the size of the ulcer. So diabetic foot patients usually present with a non-healing ulcer, and majority of the time it lasts anywhere between 6 to 18 months before they seek a proper doctor's opinion. Non-healing ulcer, think it is due to diabetes. It is predominantly due to nerves damage, accelerated by reduction blood supply, and finally due to a deformity of the foot, further adding to the progression of the problem. Sometimes these patients can present with leg pains even at rest, or gangrene, that is a blackish discoloration of the foot. So in those circumstances, this is when we call this patient has got a critical limb ischemia. The importance is, whenever there is a diabetic foot, the advantage is if we reverse or improve the blood supply to the foot, these non-healing ulcers get healed quite fast. The diagnosis of diabetic foot is with a periodic evaluation of the feet. One can identify the disease in the early phases, especially like how we check our face. If we are able to examine the feet with the aid of a mirror, underneath the sole of the feet, then people can identify an ulcer quite early during the disease process. Subsequently, the gold standard test for the diagnosis of reduced blood supply is by Doppler test or the duplex scanning. So this is an ultrasound scanning of the lower limb. We identify whether the blood supply to the leg is good or not, if it is reduced, how much it is reduced, or sometimes if it is blocked completely also, we can identify the blood supply to the leg using a duplex ultrasound scanning system. Once we are clear that this person has got a blood supply reduction to the leg, the next test what we perform is a CT peripheral angiography. So using a CT scan, nowadays we get advanced information on the blood supply to the lower limb using the CT scan, and if the blood supply is reduced, we can know exactly what is the percentage of the block, how long is the block, are the vessels getting reformed after a certain length of blockage, and how are the blood vessels beneath the leg. All that information, very minute information, can be obtained with a CT peripheral angiography. Screening test is a duplex scanning, the gold standard test is the CT scan, and the therapeutic treatment, that means for the treatment of the blood vessel blockade, we do a angiography and then treat the blocks in the leg vessel. So in conclusion, for diagnosis of diabetic peripheral arterial disease, initial suspicion by the patient in the form of periodic examination of the feet with the aid of a mirror, even at home, using a duplex scanning to identify the blood vasculature, to exactly delineate how critical and how long the block is using a CT peripheral angiography, and finally for the treatment or the removal of the blocks in the blood vessels, we can do an angiography and remove the blocks using a balloon and stent subsequently. How can we prevent diabetic foot for progression? The first and foremost is excellent control of diabetes over a long period. That's the number one. The second thing is, majority of the people with diabetes tend to have ingrown fingernails. That means usually the nails of the toes, they become longer and they get bent. So that is what we call as the ingrowing of the toenails. And these toenails, removal of thickened skin from the sole, and it needs a lot of removal of the dead skin from the feet, are critical steps to prevent damage to the feet. So good foot care in the form of preventive treatment by removing the nails, by removing the dead skin on the feet, is of the second important role. The third preventive step, which is very important, is do not walk barefooted. If you walk without any footwear, you have a higher chances of injuring your foot, that is leading to a non-healing ulcer or an ulcer which gets formed. Then the fourth thing is, if there is a neuropathy, that means if there is a nerve damage, periodic examination of the nerves function of the limbs is important. If there is a nerve damage, wearing good high quality protective footwear, usually a sports shoe type of a thing, to prevent damage to or risk of injury to the lower limb is important. Then many of the time, as we have already understood, that diabetes is associated with a claw foot or a bent foot or a rotated foot. That is what we call as the Charcot's disease. If there is any evidence of Charcot disease, it is very important for us, whatever is the deformity is in the foot has to be corrected either with a splint or sometimes with a surgery, especially with an orthopedic surgeon. So these are the 5 preventive steps for prevention of diabetic foot. Let me summarize for you. Good control of diabetes, hypertension, stopping smoking, that is the lifestyle modification. The second is periodic examination of the feet with the aid of a mirror. Then the third thing is avoid walking barefoot. The fourth thing is, if there is a neuropathy, take care of the neuropathy by preventing injury and taking adequate vitamins to prevent further nerve damage. And finally, if there is any distortion of the foot or any orthopedic abnormality because of diabetes, that is due to the muscle wasting, in those circumstances, you need to get that corrected either in the form of a brace or a splint, or rarely a surgery might be required so that the pressure points on the feet are evenly placed. The treatment of diabetic foot is multidisciplinary. That means one needs to involve multiple doctors for the treatment. It is a complex disease. We need to get it treated early. Why we need to get it treated early is because if you don't get it treated, there is a risk of losing the limb. If the limb is lost, that means even a few toes lost also can lead to a significant reduction in the lifespan. For example, a forefoot is lost or a leg is lost, there is a 50% chance that the other limb also will get lost in the next 2 years. Any loss of the limb is associated with a higher chances of death. By almost 50% of them who lose the limb will die in the next 2 years. So losing the opposite limb is a risk, losing life is also a risk. So it is very important that we treat these patients early. The treatment, as I told already, is multidisciplinary. We already understood that there are 3 important components in the treatment of the leg problem. One is treatment of the vascular problem, that means the reduction in the blood supply has to be corrected. Treatment of the nerves problem, that is whatever is the muscle wasting and all that by proper footwear and all that has to be corrected. Finally, if there is any orthopedic abnormality, that also has to be corrected. And in addition, the sheet anchor apart from these things is a podiatrist who can take care of the wound healing by appropriate offloading. That means remove the weight of the limb, do not allow the patient to walk. Usually the leg wound heals well. So in conclusion, improvement of the blood supply to the leg vessels by an angiography and angioplasty, usually by a cardiologist. Improvement of the nerves problem by adequate food protection and vitamin deficiencies correction. Adequate correction of the foot abnormalities by form of surgeries using a orthopedician, and the main role of a podiatrist who helps in getting the wounds aggressively cleared by using good topical therapies or new generation ointments on the ulcer to prevent further progression of the wound as well as rapid resolution of the wound.